Have you ever looked down at your toes and wondered if they could tell you more about your health than any doctor's visit? According to Dr. James Carter, your feet might reveal the first signs of heart problems, circulation issues, and even age-related muscle loss, long before you feel symptoms elsewhere. It sounds almost unbelievable, but it's true. A simple 5-second foot test can give seniors over 60 an early warning about their cardiovascular health. And the best part? You can do it right at home, without expensive equipment, and with no risk. Today, Dr. Carter will guide you through this test, explain what your results mean, and show you natural ways to restore circulation, strengthen your heart, and prevent leg cramps, joint pain, and poor sleep. By the end of this video, you'll not only understand what your toes are trying to tell you, you'll have a simple daily routine to improve your heart, muscles, and overall wellness. Why this test is important/benefits. Here's why Dr. Carter's foot test is a game changer for seniors. Early detection of circulation problems. Legs and feet are often the first areas to show signs of restricted blood flow. By checking your toes, you can detect issues before they become serious heart problems. Prevents muscle loss and weakness. Poor circulation reduces oxygen and nutrient delivery to muscles, accelerating sarcopenia. This test helps you monitor and act before strength declines. Reduces nighttime leg cramps. Cramping often starts when blood flow is insufficient. Improving circulation can prevent painful disruptions during sleep. Supports joint and heart health. Proper circulation nourishes joints and ensures your heart isn't overworked pumping against stiff arteries. Simple, fast, and safe. No complicated devices, just a few seconds at home, making it perfect for seniors who want to take control of their health. Think of this as a daily heart checkup in 5 seconds. Most people ignore their feet, but Dr. Carter says they can reveal more than any routine test if you know what to look for. Step-by-step guide. The 5-second foot test. Before you start, make sure you are sitting in a comfortable chair or lying down. Remove socks and shoes. Keep a towel or soft surface under your feet. Step 1. Toe color check. Lift your foot slightly off the floor and press your big toe gently with your finger for 2 seconds. Release and observe how long it takes for color to return to normal. Normal response. Color returns in 1 to 2 seconds. Warning sign. Color takes longer than 3 seconds, or toes appear pale, bluish, or purplish. Why it matters. Slow color recovery indicates reduced blood flow, often an early sign of arterial stiffness or circulatory decline. Detecting this early can prevent heart complications, leg cramps, and mobility issues.
If today's video helped you, please give a thumbs up. It really supports the channel. And don't forget to subscribe and tap the bell icon